people with a mental health condition, it can be really very difficult to access services provided by the NHS. The Right Treatment, Right Time report that Rethink Mental Illness published last year showed that the more unwell you are, the longer you have to wait for services. Services have really improved over the last few years, but we still have a long, long way to go before mental health is valued as equally as physical health. And that's why it's so important that we have the voluntary and the third sector providing services within the community as well. People need support when they become ill. They need support after or when they're in recovery. And the voluntary sector provide a lot of those services. The whole gamut, the whole range of support, from advocacy to community services, housing services, support for people trying to find employment and work. In Rethink Mental Illness, we have a number of support groups across the country. In fact, our organisation was started by groups who came together to support each other and campaign for better treatment and services for people with mental health conditions. The groups develop according to the needs and the wishes and interests and skills of the people that use them. So those groups can provide anything from information about mental health or about navigating the mental health system, to gardening projects, to cooking, to art and craft, activities that really do support people with mental health conditions in their recovery journey. If you're concerned about your mental health, or of someone that you know who maybe experienced mental health issues, the best place to go to is to contact your GP, and they'll tell you about the services that are provided in your community. If it's an emergency, you can phone 999 or go into A&E, Accident and Emergency Department, and they'll get you the help that you need there. People aren't always aware of the support provided by the voluntary sector. Actually, they're not aware of the support and treatment and services available in the NHS either. We need to be able to get that information out there, and that's where I see an important role for the WI. We, as WI members, have the power to find and guide people to that support. You can raise the profile of mental illness in your area. Ask the local health trust or the clinical commissioning group to come and talk to you and tell you what services are available, how they're accessed, and actually ask, do they meet the needs of the community that you're living in? And if not, what are they going to do about it? Local WI members could also contact local charities, find out about support groups, and then provide that information to others who might need it. Accessing services can be difficult, but the WI can make a difference.